The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio, waiting to take your calls on anything you'd like to talk about your health. You've had a problem. You've done all kinds of things. You've tried and applied all kinds of different approaches, but guess what? Hasn't worked, right? Well, here's your opportunity. Give us a call, 888-630-9625. 888-630-9625. Love to talk to you and see if we can work the puzzle out for you and make a difference in how your body operates. You know, have you ever wondered why things happen at certain times of the year? You know, you get the allergy reactions in the spring, you get the fall allergy reactions in the fall, and there are times of the year that you don't feel so good. You sleep better at other times, and you hurt at other times, and then go to day-to-day basis. You know, you have a headache in the middle of the afternoon, or you wake up in the middle of the night and your stomach is grinding, or you can't breathe at nighttime. Have you ever thought about why that happens at those times and not at other times? Well, there's a reason, and it's called your body's cycles, rhythms and cycles. The body goes into ebbs and flows. And we're going to talk about that today, and we're going to talk about that this Wednesday evening, February the 6th, 7 p.m. at the Roselle Center for Healing, Fairfax. That'll be our in-house continuing education program topic. And who better than to go through this that has a very keen insight, but Dr. Stephanie Pina. Welcome.
Thanks for having me back.
Oh, of course, of course. You know, but listen, this is fun because you have an insight in Asian medicine, traditional Chinese medicine, but also as a doctor of naturopathic medicine. And we look at the body's ability to ebb and flow. We look at its, we wake up in the morning and we should be bright-eyed and bushy-tailed and, ready to take on the day. But unfortunately, so many people don't do it that way. It's like, let me stay here for another 3 hours and then maybe I'll think about getting up. Or, I don't understand why I'm feeling so bad all the time. I start out my day feeling well, and then all of a sudden, boom, I stop. Or, in the afternoon, I have this urgency, and, or at nighttime, I feel miserable. There's reasons for that. As we get into the program, I'm going to get very specific about those things and probably some emotional patterns as well. But is it really true? I mean, are we making this all up, or is the body responsible? Is the body the culprit?
Well, the body's a culprit because essentially it's all working together, and we would love to separate things out the way we see in conventional medicine, where if one part of the body is going wrong, we go see that specialist. If there's a heart issue, you go to a cardiologist. If there's a urinary issue, you go to a urologist. Unfortunately, it doesn't work that way, and we've seen time and time again where one part of the body, if it's misaligned, if it's not tuned in right, will create issues in another part, and basically it's just one sign that's telling us we need to do something about it. And when we see people come in and they have no reason why certain things are happening at certain times, or they don't seem to get the connection of why their body's not able to heal when it should respond like everybody else did, that's where we have to look beyond just the organ systems, beyond just even what time of day it is, but beyond just the medications that they'd be given to treat that one issue and say, well, what else is the body trying to tell us that's off balance, and where do we put that back into balance? And we look at that from a Western medicine perspective and an Eastern medicine perspective.
It's interesting. Patients will come in and say, I get to sleep at nighttime, and I don't have any problem falling asleep. I'm exhausted. And then at 2 o'clock or 3 o'clock or after 3 hours, I'm awake and it takes me forever to go back to sleep. Or, suddenly they'll get this craving for something at a certain time of the day. Or, don't talk to me, after I've had a meal because, I can't think. My brain shuts down. So you have all these cycles that people continue to relate. When I was some years ago, I was having a really hard time sleeping through the night. My brain was constantly, going through things. And Connie, our operational head of the practice, is also an acupuncturist. And she treated me for about I think probably about 7 or 8 times, and I was able to sleep, and it turned everything off, and that stress pattern went down. So what I want to ask you is simply this, whether it's a sleep pattern or whether it's even libido. A guy came in the other day and said, I don't get it. If my wife wanted to be intimate in the evening, I'd be good to go. But I wake up in the morning and, until the day goes on, nobody's working, not happening. Let's talk through those things. Well, those are common things that we see all the time in the practice, from sleep disorders to headaches that happen at a certain time. And, they all interrelate. So how do you look at a patient relative to their body rhythms, that explains that? And then I want to get into cardiovascular problems as well, because that's really important.
Well, I think what's interesting is when we're talking with a patient, we're trying to first identify some of these certain times when it might be happening. If there's an issue, like the sleep issue, is it an ability to go to sleep, or are you sleeping through the night and then waking? Is that happening at certain times? Same thing throughout the day with the headaches. If there's certain times, like after they eat, now there's the headache, or before you're eating, those times can play preferences to different cycles and different patterns, because we know that we have cortisol cycles, we have hormone cycles, we have daily cycles and monthly cycles that are happening that can play an influence on the rest of the body chemistry that's going on within us. So as practitioners, we need to first kind of recognize what's going on with this person. The great thing is, especially with our patients that come in, they get used to us asking these questions, so they get more and more in tune of their own answers. And so they start saying, well, it wasn't as bad at this time, but it moved to the next hour. That's great information, because we want to see how your body is particularly processing certain things. And then there are certain organ systems that are more active at certain times of the day. So we want to see, does this make sense for what's going on? And is it too much going on, or is it not enough going on? And then we try to balance it that way. And that might take into consideration chiropractic care, acupuncture, nutrition, exercise, all sorts of different things. So a lot of the times it starts with trying to figure out when those time periods are, what's going on with them, and then also where do we take it from there? Why hasn't the things that you've done before worked, or what has the patient done before that hasn't worked for them?
Hey guys, if you really want to find out why you have dinner at night and it's the only meal that your stomach blows up like you're about 5 months pregnant, and you feel miserable until probably the middle of the night, and then starts getting less and less, there's a reason for that. And this Wednesday evening you'll have the opportunity to get intimate with those patterns. This Wednesday evening, February 6th at 7 p.m. at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina will talk you through this whole thing and show you why. But more importantly, if you really want to resolve something, you have to understand how this mechanism, how this cyclic pattern works. Dr. Pina, there's people that have greater strength also at different times of the day. And, they feel stronger, they're able to do more, they feel like, that they can handle whatever is around them. And also throughout the year, we know that we have not only 24-hour cycles where we feel good or stronger or miserable or worse, but we also do that during the year. Why does that happen? Why does somebody say to you, don't ask me to do it, I have to wait till much later, and then I can get it done?
Well, we know that throughout the day and through the months and through the years and stuff, these cycles we have our highs and lows. And so whether we're talking about energy or strength, we also have times that we know we feel better, just like we know that there are certain comfort foods that makes one person feel better, whether it's supposed to be good for them or not. But there are comfort foods that make us feel better.
We won't talk about that.
No, that's a suit conversation.
Yes.
But we know that there are things that help strengthen us. And so what's interesting is our own constitutional types can play a factor into this. Why do we gravitate towards work at one point in the morning or in the afternoon? Or why do we have people who are night owls that seem to do better? It doesn't always mean that that's the best thing for them, but you definitely see these ebbs and flows, and it can be part of their constitution, or it could be their body trying to compensate for things that have been going on for a long time. So this idea that we all have these cycles, we all go through them. The good thing is there's going to probably be highs and lows points just like in our health, but throughout our other cycles as well.
So what we're talking about is this intimate energy pathway within the body that has a ebb and flow throughout the day and throughout the year. So there are certain points throughout the day that there are certain systems that have more energetic expression, if you will. We'll use that term. So I said earlier about how somebody bloats at nighttime. Well, we know that if we take the energy pathways. We can divide them up into 2-hour peaks and lesser and stronger above and beyond that peak. When it comes to that bloating that we talked about early on, I was suggesting gallbladder, liver, stomach function. And the energy for the gallbladder, if you will, is higher at nighttime. And so it generally, as you start approaching, 7, 8, 9, but particularly around 10:30 till about 1 o'clock, 1:30 in the morning, because of time shifts here and there across the world, you're going to see that gallbladder, if there's something wrong with it, it's going to express itself more formidably at that time of the day. So you're going to feel miserable at that time of the day, more so than you will ever at other times. And if you look at hospital records, it's interesting that greater numbers of people are admitted to the emergency room at night for gallbladder problems than they are any other time throughout that 24-hour cycle. And, that's the important piece. So here's the other piece that I'll ask you. If that's true, if we have ebbs and flows, one, is it necessary that we understand it to treat the patient? Secondly, is it important to treat them in some way as close to that peak than at other times during the day?
So yes, and thank God, no.
So you don't want to work at night?
Because apparently, well, you can keep the hours open, but
got it.
I guess you're going to have those
it's
hours.
It's all about me again.
Yeah. So yes, we have to totally understand what's going on during those times and how that communicates with the rest of the body. Because the good thing is where the body is a holistic system, where one organ system can affect another one, we can do things throughout the day that allows us to treat during normal hours and then almost give them either supplements, homework, digestive support that can help them when they're not in the office. So during those times, it can help to support the gallbladder, help support the liver. Because I can guarantee you, I don't think we're going to get anyone on the schedule between 1 a.m. and 3 a.m. in the morning.
Well, unless you live in New York City.
Maybe.
I actually have a friend of mine that is open till about 2 o'clock in the morning in New York. But he's a sick human being, and we won't talk about who he is. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're talking about how your body actually works, the ebbs and flows, the rhythms, if you will, of how things express themselves differently. Here's another piece. Do medications have an effect first? Do they work better at certain times if a physician was supposed to give them, something for whatever, opposed to, do they have greater side effects?
They absolutely do. And what's interesting is there are certain medications that even when they're processed through the liver, the liver has to turn those on. So if we don't have a proper functioning liver, it can either turn on too quickly or too slowly. Even when we add other medications in there or even supplements and herbs, sometimes it can make a difference. But there is a list of medications, that tend to be better given at night. And unfortunately, I wouldn't say that that's going to be on your list that you get from your pharmacist that says, here's the best and most optimal time to when to take this.
Not so much.
And it's the same thing, too, when you see blood pressure issues. If someone has a hard time and they're taking medications and they're getting really tired, that nighttime, if you're going to go to sleep, probably is going to be the best time. But they're not getting that information.
We're going to talk more about how your pain patterns ebb and flow, why they show up at certain times of the day, and others they're kind of quiescent. And then we're going to take your calls, 888-630-9625. You're listening to Dr. Tom Roselle Live. My guest in studio, Dr. Stephanie Pina. We'll be right back. Don't go away. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We're in studio. We're talking about your body rhythms, on how things ebb and flow not only through the day, but over the course of the calendar year. Sometimes you feel better, sometimes you feel worse, sometimes you hurt, sometimes you don't, sometimes you just, you have all the energy in the world. You feel like, a superhuman being. And there are times when somebody pulled that plug and they can't get you out of your chair to save anything. And we're going to get into the why behind that, but more importantly, how it affects your overall health and wellness and why things break down if you don't make the change. And why, we talked a little bit about your gallbladder and why it can pop at nighttime. And a lot of surgeries happen at night when it comes to gallbladder than it does during the day, unless it's elective. And that's a whole different story that you don't want to get me into right now. 888-630-9625. My guest in studio, Dr. Stephanie Pina, your host, your presenter this Wednesday evening, the 7th, at the Roselle Center for Healing, 7 p.m., this topic. Let's go to the phones. Denny, thank you for holding. How can I help you, sir?
Thank you, Dr. Roselle. With regard to rhythms, I've taken a job at night, and I'm wondering if you could address that transition between, being awake during the day or I'm having a little trouble, getting it up and going to work at night. And if you'd address that, I'd sure appreciate it, and I'll take that off the air.
Okay, Denny, thank you. We'll get into that actually very, very directly.
Denny, real quick, is this a new job, or have you been a night shift worker for a while?
No, this is a new job.
Okay, so that transition is going to be very difficult because one of the things that's happening is that your body's so used to the normal clock cycle, right? You're waking up during the day, your cortisol says wake up in the morning and then go to sleep at night, and so now we're flipping that cycle. So one of the things when I've talked to night shift workers that has helped with them is to try to make that it seem like that night is actually your daytime, and to slowly try to transition to it, and hopefully you'll have a type of shift that you have a longer period of time. Once your body gets used to it, it can go into that rhythm. When some people have to switch back and forth every 2 weeks, that's very difficult because your body doesn't know what time it is. So you can do things to help support your natural melatonin levels, like more so during the day, and then also with kind of using it like melatonin and also magnesium and B6 to kind of help it increase its levels so that when you're trying to go to sleep, when it's bright outside now, you can try to help to relax the body a little bit more to think that it's nighttime.
There's a couple issues with that in addition, and everything that Dr. Pina just told you is absolutely straight up. But here's the other piece. When we go overseas, our whole clock changes, right? So we go into Europe, or we go to Asia, or we go wherever, and there's 6 to 8 hour changes for some people. And particularly when I fly and I'm all over teaching, it takes me, and I've learned to adapt to it. It takes me a while to get my feet back together, and particularly if I'm flying west and I'm coming back, or east rather, I'm going from the west coast to the east coast, it's worse. But at least the sunshine is normalized in that part of the world. So even though that it may be nighttime here in the United States that I'm used to, over there the sun is still going. Where you are right now in the cycle that you get yourself into, it's nighttime when it should be your daytime, and your body's energetics need to adapt based on the clock that's outside, and it's very difficult to adapt otherwise. So you're going to have to do things that are going to shift that ability. There's the SAD lighting that you can get. You go online, and seasonal affective disorder lighting. It's very inexpensive. You can buy them for a couple $100. And you spend a little time sitting in front of that, about 30 minutes, when you would be having your breakfast, so to speak, and it would help you readapt to that. But as Dr. Pina suggested, at nighttime, your pineal gland is supposed to be operative. And so it starts putting out all kinds of different types of hormones that stimulate your pituitary. And so in the daytime, when the lights are on, it gets its nourishment, it gets refreshed, it gets refueled. Now you're screwing that whole thing up. So you're going to see hormonal changes in your body for a while. Some of our night shifters that have been like that forever, they seem to adapt a little bit better, but they still have to get a period of sunlight during regular day to be able to adapt completely.
And also the thing you got to think about is if you're going in, say, starting at either 9, 10 o'clock at night and then getting out at anywhere between 4, 5, 6 o'clock, 7 o'clock in the morning, what happens to your blood sugar cycles at that time? Because your whole eating pattern is off. Basically, you were sleeping during that whole time where now you're very, very active and probably have like a lunch break in there. So you have to kind of regulate some of your eating to appropriately figure out where that daytime cycle is during the nighttime as well too, because that will help also with energy and energetics throughout the day as well, or your night, I should say, your night day, at the same time.
So you can make a difference, Danny. You have to recognize the fact that things are shifting dramatically, and you have to then kind of shift your way of life to support a normal cycle as best you possibly can, and then implementing some of the things that we just talked about. Dietary patterns have to be shifted so they're supportive of that transitional period. Your activity level has to be shifted. The way that you eat has to be shifted. If you do those things, it'll be an easier transition. But the other piece is that if you have any hormonal hypofunction to begin with, they can be made much worse during that shift. Energetic support with certain herbs and acupuncture and things of that nature can be very, very useful, very, very helpful. If we can help you just give us a call. We're more than happy to do that. We're coming up to the halfway part of the program. We're here at 888-630-9625. My guest in studio, Dr. Stephanie Pina, will be your host this Wednesday evening, and she'll be talking about exactly what we're talking about, but very much in depth on body rhythms and cycles. So we'd love to have you there. All you have to do is go to rosellecare.com. Don't go away. We'll be right back and get to your phone calls.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-9625. Give us a call. Would love to talk to you. My guest in studio, none other than Dr. Stephanie Pina. Dr. Pina, as all of you know, is a doctor of naturopathic medicine, also an acupuncturist. And we're talking about something that we all see with our patients, and those are different types of presentations due to the different cycles and rhythms that occur within the body, not only daily, but also throughout the year. And we're going to talk about it intimately. We're going to talk about why people have chest pain and heart symptoms at a certain time as we go through the program today. But if you have problems that seem to ebb and flow, you want to know how to get rid of them, this Wednesday night's an opportunity, the 7th, at the Roselle Center for Healing in Fairfax. Join us. All you have to do is go to rosellecare.com. That's ROSELLECARE, rosellecare.com. Scroll down halfway. It says register here, register now. Hit the button, do it today. And as you know, we have limited number of seats in our office, and once they're full, they're full. And we'd hate to say, I'm so sorry. So make sure it happens, okay, so we can confirm and make sure that you're there. Let's go to the phones. Maria, thank you for being patient. How can we help you?
Yes. Hi. I was wondering what the connection could be between intestinal functions like bowel movements and heart rhythm. I have a condition where sometimes my heart skips a beat, or there's a pause between beats, and my doctor says it's fine. I've had this for like the last 40 years. But I notice that, of course, if I don't get enough sleep or I'm anxious, that happens more. But the question I have is, sometimes when I feel like I have to have a bowel movement, that happens. And I'm just wondering, I know there's a vagus nerve or something. Is there a connection between that and your heart rhythm?
Well, I'll do the first part of it. I'm going to let Dr. Pina get into the second part of it. So
Can I hang up?
You can hang up if you want to.
Okay.
We'll answer all your questions. So here's how that works. The vagus nerve is the longest nerve in the body, and it's a cranial nerve. It comes from the brain, and it goes down and it touches virtually every organ system that you have. And yes, it does touch the heart along with the electrical system from your spine, but also the pacemakers, the intrinsic electrical system. So the heart is controlled by the vagus nerve as well as other inputs. A lot of the misfiring that occurs within the heart, whether it's atrial fib or ventricular misfiring and extraventricular contraction, those types of things, you have to understand that it's neurological, but it's also biochemical. It can be magnesium, it could be potassium, it could be an imbalance of sodium, too much or too little within the system, or a combination of those things. Stress patterns, particularly we call it the college syndrome, where kids start studying and they pull all-nighters and they drink too much coffee, and now their heart starts flipping around in their chest. And what they need at that point is a lot of extra vitamin B complex, water, and sleep, and get rid of the caffeine, and everything goes back to normal. Magnesium is one of the primary culprits when it comes to the heart. Low levels of magnesium will cause your heart not to fire properly, also your brain not to work the way it's supposed to. So the short answer is yes, the vagus nerve can be a culprit. The upper part of your neck and your skull, the way it sits and aligns itself on the spine, can cause an irritation to the vagus nerve, which can allow it to misfire electrically, and so subsequently you have all this happenstance, but it can be fixed, by the way, and it's things that we see, on a day-to-day basis. The ball's in your court, Dr. Pina. It's
a great question. It brings everything together, so thank you for calling in with that one. It was great.
Doesn't it?
It's so great. So, and also the vagus nerve has a connection that goes to the colon as well, too. So when we bring in the bowel part of this piece, too. What's amazing when you look at it from a Chinese medicine standpoint is that it doesn't even necessarily have to be the vagus nerve, but there is a connection between the heart and the small intestine. So now we have a medical, anatomical, neurological connection that we can back up from thousands of years old Chinese medicine clock, where the heart and the small intestine are right next to each other in the same kind of 2 to 4 hour time zone. And what's great is that when we try to think about things moving out of the system, that can be our heart. We're trying to move things. And so when we have a increased rhythm, decreased rhythm, we notice there can be emotional issues with that too. Sometimes we feel like we want to release things. In some way, that's starting the digestive system as well too. So it's getting that signal to move things out. When Dr. Roselle was mentioning the different types of minerals and stuff that can affect the heart and the blood pressure and the rhythms, what's interesting is, what does the small intestine do from a Western medicine standpoint? It's absorbing all that stuff. It's absorbing the minerals. It's absorbing the calcium, the potassium that the heart needs to function, that muscles need to contract. So there's definitely a connection in between there. But as we're seeing here, you can look at things from a lot of different sides, but you see how they're also connected on a deeper level as well, too.
You know, we were talking earlier, I said that we would talk a little bit about the heart and the energetic platform and so forth. And there are energetics. Most people will experience some form of chest pressure and irritation, not necessarily as you get closer to the heart rhythm, but as you get on the other side of it towards its balancing act, the small intestine that you just brought up. And that's when we see the greatest majority of heart attacks ending up in death, is in the afternoon, because the small intestine in Chinese medicine and Asian medicine is the buffering system, if you will. I'll use it that way. That allows people, but if that energetic platform is not working, if it's not flowing together, then it backs up into the heart, and the heart has nowhere to go except to, I'll use the word explode. I don't mean it that way. But it ends up with the heart attack or whatever is going to stop it. So we have all these little pieces that have to be considered, and that definitely is a rhythmical pattern. And again, Dr. Pina said that it ties everything we've been saying together. It's a perfect analogy.
Yeah, I couldn't have, we didn't plan that call either.
No, I appreciate it. Thank you very much. I don't know Maria, full disclosure.
And then bringing it back, what's interesting is sometimes you look at the other end of the cycle too. So where the heart meridian is usually, that time period is 11 a.m. to 1, where we were talking so much about the gallbladder before. On the other end in the evening, 11 to 1 is that gallbladder again, and its buddy is the liver, which we used to say all sorts of things about how it can emotionally deal with the body. It's our biochemical and our emotional detoxifier. So if we're not getting rid of things processing into the night, is it affecting the daytime at the other end of the cycle? So there's a lot of these connections are what we need to look at, and it's certainly not something that's looked at from a Western mindset in this perspective. But when you start to walk through these cycles, you start to see why these different organ systems on the Chinese medicine clock are actually in the order that they are. And it gives us a pattern of how when we should eat, when we should do things, when we should exercise, even when we should socialize as well too. So,
you know, years ago there was hygienic eating, and there were a couple folks out there that perpetuate this, and they said you shouldn't have anything that has any solid mass to it dietarily until about 10, 11 o'clock in the morning, and that you eat the greatest majority of your food during another 12 to 14 hours. Today we know that as intermittent fasting. And the truth of it is that what you're doing is you're giving those organ systems, the organs of digestion, gallbladder, liver, going into the intestinal tract and so forth as the morning goes, an opportunity to rest, detoxify, repair themselves. But you have to do it very properly. And somebody who is hypoglycemic or low blood sugar has to be very careful with how they do that. But it can be done, and it's really important that if you really understand and support your body rhythms, you have a greater opportunity not to suffer. You have a greater opportunity to heal. You have a greater opportunity to optimize your body's health. 888-630-9625. That's how you find us here, and how you register for Dr. Pina's class this Wednesday evening, the 7th, at the Roselle Center for Healing in Fairfax, is simply go to the website. Go to rosellecare.com. Go halfway down the page. Hit the button, says register now. But if you don't like the internet, then go 703-698-7117 and just call and register and do it now. And we'll call you back and we'll make sure it happens. Let's talk a little bit about blood pressure. There's so many people that are being put on blood pressure medications. And unfortunately, sometimes one evaluation, they're going, oh, your blood pressure's, really high. Well, if you're like me and somebody irritates me, my blood pressure is going to go up. But they go up at different times of the day. You read some traditional medical literature, and they say the highest blood pressure of the day is in the morning. And then some people will say, no, the highest blood pressure of the day is in the late afternoon. Well, they're both true, and they're true for different reasons. Your turn.
I concur.
Yes.
Well, one, we're all individuals. So what's interesting is if we could look at this from a number of different ways. And so that's why, one, if anyone's diagnosing anything with high blood pressure, it shouldn't be based on one reading, first of all. And you should be seeing it over a couple of periods of times. And we also look at the adrenal functions as well, too, to see what's going on. But what's interesting is you have cortisol rising in the morning, so it would make sense that we're going to have more blood flow. Things are going to move more because we're supposed to be up and active and going. So that would make more sense that the body says there's more demand, there's more need, let's move this. And if it's something that's an issue with, say, the arteries are stiffer and they're not moving as well, your blood pressure is going to come up because it's more blood flow moving through those stiffer arteries. If it's more in the afternoon or the evening, it may be because now you're coming off of work, and especially in this area, if you have to, say, fight 495, or you've got all these other stressors now coming into you and your body's at its lower point, it should be starting to calm down, but you've got these external stressors, the outside factors that are kind of also keeping you in your fight-flight mode. All of a sudden your blood pressure goes up when you should be in that relaxed mode. So that's not going to help as well either. And those people are typically the ones that may have difficulties going to sleep at night because now they feel like they have to burn off energy. So they're saying, I'm going to work out and try to just relax, but they can't do it. So you could see both of those, and that's why sometimes we see different medications given at different times, but you don't switch back and forth between them.
You know, the interesting thing in the afternoon pattern and the morning pattern, they're very similar, but again, for two different reasons. In the morning, you mentioned the reason is that the cortisol is supposed to spike, and that is produced by your adrenal glands, your fight-flight glands that sit on top of the kidneys. And they squeeze a little hormone called angiotensin into the blood. So if there's an abrupt shift in that cortisol, your blood pressure is going to start coming up, and simply because of what you said, that the arterial beds aren't prepared, if you will, to take this increased blood flow. And by the way, a lot of morning headaches are there for the same reason. It's simply because that system isn't able to receive that increased pressure, the blood flow, because of that. The other piece in the afternoon that you were hitting on is, and everything you said is on the mark, is the highest energy for the kidney is late in the afternoon. And just as the bladder kidney meridian is kind of at that, 4 o'clock, 5 o'clock, 6 o'clock time of the day. And so if the kidneys aren't working, you're going to get a blood pressure or a headache that's associated with that because of that operation of kidney. So that's how you can distinguish, for me, particularly if we took a blood pressure, we take blood pressures in three different positions. We take that sitting, we lie the patient down, and we stand the patient up. And what we're looking for the first time the patient comes in is not the amount of blood pressure, because, we're taking you off the streets, we're having you fill out paperwork, your stress level's up, you never met us before, you wonder what this craziness is all about. But what I'm interested in is the flux of blood pressure from one position to the other. So when a blood pressure is, I'm making these numbers up, let's say somebody comes in, they have a blood pressure of 125, over 70. And then we lie them down, and their blood pressure goes to 134 over 73, 74. And then when we stand them up, their blood pressure should remain, the same, but it may spike way up or it may go down. But what's important to me is the shift. So if a blood pressure goes up when somebody is lying down, it tells me that the kidneys are not filtering the way they're supposed to, or at least suggestive of it. It's not absolute. These are diagnostic. We better take another look at this thing from a different perspective. If you stand up and your blood pressure goes down, it means that cortisol piece that you were talking about, which also is responsible for producing something called angiotensin, angio meaning blood vessel tension tone, is not adequately being kicked in. So you stand up, and one of the symptoms you're going to get dizzy. Not all the time, not every time, but often, particularly if you're bending over, tying your shoe, picking up your purse, and you get up very abruptly, that may happen. So it suggestive of that there are other mechanisms here at work, exactly what you were talking about. So we look at kidney late afternoon, and we look at cortisol spikes early in the morning, and that has a lot to do with that normal circadian rhythm that we were talking about early on. So these are normal body patterns that are controlled by all the intimacies that we call the neurohormonal fluxes, if you will, in Western medicine. And then from your background, Dr. Pina, it's, the energetic platforms that are there. And these are some of the things I know that you're going to get in depth with, and why these headaches and why these problems and so forth. Let's talk about back pain. Simple, straight up back pain. Some people complain of back pain only, at a certain time of the day. Maybe it's late in the day, and they say, well, I've been sitting all day long, or, at nighttime, and, I've been whatever. That's not necessarily the case, is it?
Not really, and I think, again, it all goes back to figuring out what's going on with them individually. A different type of cycle that I always think of, too, and it's a little bit of a specialized ones that I see more and more common now, is I look at, what I call the industrial cycle. What do we do, and when are we doing it for our job and our work, and what's our pattern within that day? So if you have someone who is standing on their feet all day long, you would think that their back's been tense. Maybe at the end of the day, they're getting more fatigued, so their body's going to basically try to tense up a little bit. And that's maybe where they notice it, or they're having disc issues at that point but other times it could be if they open up everything and they have a chance to rest, they could be worse, and it's more stiffness like arthritis in the morning. You can definitely see different patterns for different musculoskeletal issues, just like we were talking about the organ systems. And so it's all information we have to take into consideration versus it just being a Western medicine diagnosis, or depending on just simply what does an imaging say or your blood work say, because you're not just your pictures and you're not just your blood work either.
It's really important for our approach to health and wellness to understand when certain things happen. And, this time of the year, for example, people are getting sick. And some people don't get sick. And they seem to have the strength, the ability to stave off, fight, if you will, the onslaught of all these bugs and bacterium and so forth and viruses that are out there. The truth of it is that these viruses, these bacterium and so forth, have been around all year round. But we're seeing a shift in the energetic movement of the body. We're seeing a shift in the energetic platform of the globe of the earth and its vibrational patterns and so forth. And we're all intimately connected to that. How would you explain that to somebody other than the way that I normally do, is that you eat too much crap this time of the year and your sugar, you're eating too many, you're drinking too much alcohol, drinking too much sugar, and now we've got all this. What's the other piece?
Well, that's certainly playing a huge piece into it, especially this time, because I always say everyone comes in that third week in January after they've survived the holiday seasons and all the partying and everything that they've done there. But each of the seasons also have a pattern and a cycle with them as well too. And what's amazing in Chinese medicine is usually you're supposed to start 2 seasons before when you have these issues. So if we talk about all the allergy issues that we might get in the springtime, which we know at least in the DMV area is starting to become earlier and earlier because of the weather changes, we should be treating those now, if not already, to help tonify what's going to happen in the springtime. So you see these patterns that kind of come up, and there are definitely reasons why they're doing what they're doing.
Yeah, we're totally reversing so much of what we should be doing naturally. And I know this Wednesday evening you're going to get into the intimacy. We're going to talk about that when we come back from the break. This is a fun program. My guest in studio, Dr. Stephanie Pina. Don't go away. We'll be right back after some important messages.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You've been listening to Dr. Tom Roselle live, as you do every Sunday at high noon on the Eastern Seaboard. Those of you who are around the country that are listening to us or listening to us online, thank you so very much. We appreciate it, and we try to get to your questions as quickly as we can. If you ever have a question that you want to have answered immediately, just call our office at 703-698-7117. That's 703-698-7117. And ask our staff to have one of our doctors call you, and they will do the best they can to help you. Better yet, just come to the classes, and we will be there, and we can spend some one-on-one time with you. This Wednesday evening, this is a great class. Dr. Stephanie Pina will be your host, your presenter. We're going to be talking about the intimacies of how your body operates on a day-to-day basis and why you suffer at certain, and why it's important, more importantly, why it's critical that you treat things according to their cycles and their rhythms and where they're coming up and how you prepare for other times so you don't get sick, so you don't have to get shut down and feel lousy, so you have all the energy that you need to have, and really understand how this mechanism called the human body works. Register online. Go to rosellecare.com, click the button, register now, and join us. And I promise you, this will be a very intimately exciting presentation. You're going to learn more about how your body works than I think probably any other presentation that we do. Dr. Pina, you brought up something very interesting when we were at the break. There's a lot of people that are going to go into massive depression and blood sugar crash at the end of the day today.
Or a lot of joy and excitement.
True. That will come down on the other side into depression and, absence and so forth. Why? Because it's Super Bowl. Because the NFL is done after today. And then you're going to have to wait in anticipation for, spring camp and then next year and so forth. And all that garbage that you put in your food today, all the pizzas and all the beer and the other things and the chips and the dip and so forth and stuff you shouldn't be eating because of Super Bowl parties. And you're going to go into, boom.
Yep.
Yep.
Although they'll be happy because they can listen to the radio show on Sunday at its normal time on WMAL because we're the voice of the Redskins, right?
That's right.
So we won't have to move to Saturday. So that makes me happy. I bet it makes a lot of people happy.
Absolutely. Listen, we don't have
no matter who wins.
And that's right. We don't have to switch again to a Saturday afternoon back and forth like a ping pong ball, which messes up my cycle, my rhythm, my ability to fly and teach wherever I'm flying and teach. And then I have to say, Dr. Stephanie, guess what? You're going to have to lead the program this weekend.
Which I usually get about 2 weeks notice for, so yeah.
Well, of course, it's only 2 weeks. I can't give you any more notice than what I know.
But we can be happy about that, too, because we're only a day away from the year of the Earth Pig. It's Chinese New Year, so if we're thinking about starting things over, it's supposed to be a very prosperous year. Lots of changes coming, good stuff coming.
Dr. Stephanie, we're going to cover Wednesday night.
Well, we're going to basically cover how is the body talking to each other through these cycles and what does that have to do with our health and how do we utilize that in our office. It's one thing to just mention the Chinese medicine clock. It's one thing to mention how these systems go together from a Western and an Eastern perspective, but how are they used in practice? How do we do this based off of what patients or people are coming in and asking questions about saying, I don't understand, there's a missing connection, why am I not getting any better? Why do I get sick at certain times? Why is it that conventional things that should have helped me not doing what they need to do? What do I need to look at differently? A lot of it has to go down with creating an individual plan for you, but first we have to understand what's going on. So the more we can educate people on taking a look at their own lives at different times when things happen, looking at symptoms that don't look like they're interconnected, but they really are, the better we can create a holistic plan for you that kind of helps with a lot of different issues, whether it's structural, biochemical, mental, emotional. How do we put that together? So basically we're both part of the same healthcare team.
It's important that you understand you, and it's important that you have somebody on your team that understands you. And when you put all the pieces together from a Western and Eastern vision and other pieces around the globe that makes sense and you get to understand that structural, chemical, emotional platform, guess what? You get to do better than most everybody else. Want to wish you a happy year of the pig. For those of you who are born in that symbol, guess what? It's your lucky year.
Happy Puppy Bowl.
Happy Puppy Bowl. That's right. We're going to predict. You had to get that in, didn't you?
The Roughs are going to win this year.
We'll talk about that later after the program's.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.